So hi there, my name is Emma and I'm from the Yinova Center. Before we dive into our discussion on fertility, for those of you who are new to either RMA or Yinova, I wanted to let you know a little bit about both of these centers, as well as tell you a bit more about our speakers. RMA of New York are leaders in state-of-the-art reproductive medicine. The fertility clinic is led by an integrated team of doctors and scientists with extensive experience in fertility testing, IVF, egg freezing, and LGBTQ+ family building. They're offering virtual consultations and have also opened their doors for fertility procedures. The Yinova Center is an acupuncture and Chinese medicine clinic based in New York City. We specialize in fertility and reproductive care. As of recently, we've moved part of our practice online and have been offering virtual consultations to support our patients, and we've reopened our clinical doors and are available for in-clinic acupuncture as well. Dr. Jackson-Bey is a reproductive endocrinologist, an infertility specialist, and board-certified obstetrician gynecologist who cares for patients at RMA of New York's Brooklyn office. Dr. Jackson-Bey is passionate about reproductive justice and increasing access to fertility care for all. She was recently appointed a member of the newly formed ASRM Diversity, Equity, and Inclusion Task Force, which will enhance opportunities in reproductive medicine for underrepresented minority populations and reduce health disparities and provide access to care. Dr. Jackson-Bey is a talented surgeon and a dedicated fertility expert who is focused on fertility preservation, IVF success, and great outcomes for her patients. And then we have Dr. Jill Blakeway, who is an acupuncturist, herbalist, and the founder of the Yinova Center, where she's been treating patients for over 2 decades. Jill has always been passionate about helping people achieve a healthy pregnancy, so much so that the New York Times has described her as a fertility goddess and named her as one of Manhattan's top acupuncturists. She credits much of her success to combining the ancient wisdom of Chinese medicine with modern conventional biomedicine. To this end, she joined forces with a reproductive endocrinologist to co-author the best-selling book, Making Babies, about how to conceive naturally. She's also authored 2 other books on health and healing, Sex Again, and Energy Medicine, The Science and Mystery of Healing. We have some questions that we gathered prior to this discussion, which our speakers are looking forward to diving into. If you have any questions throughout this talk, please feel free to submit them and I can read them out loud for you. And with that, I'm going to pass this over to Dr. Jackson-Bey and Dr. Blakeway to get started.
Well, thank you, Emma.
Awesome.
And thank you for doing this, Dr. Jackson-Bey. I'm really happy to do this with you. And what I love about this topic is it's a topic that doesn't get covered as much, which is how do you start? How do you know when you need a doctor? What can you do at home? What can you do for yourself? What do you need specialized advice for, and that kind of thing? And I think this is actually extremely useful as a sort of checklist, don't you? That people come to us and they don't know where to start. So where do you start?
Yeah, so, I think that the first decision is it time now? In terms of starting your family now, thinking about preserving your fertility, or just, wanting to learn more information. And so I always tell patients that, that's kind of where, your decision tree lies. For the majority of our patients that we see, they may have actually been trying for some time and, recognize that, it's taken a while, a few months, sometimes even years. And so, we would always encourage anyone to come in and see us sooner rather than later. It doesn't always mean that there's an intervention that happens right away, but at least if we can get the information, try to get the story and see if anything can be optimized with what you do at home, then that's good.
One of the reasons that Dr. David and I wrote Making Babies is that we wanted people to know that diagnosis and detective work is really important. That, there are so many different reasons why people aren't getting pregnant. It's not just one thing. And so some careful diagnosis early on, and often, and I'm sure you'll agree with me here, it can be something quite small. Just, if you're not getting pregnant, you assume it's something huge because the outcome is huge. You're not, you're not every month you're disappointed, but it can be something relatively tiny that we can, in our various different ways spot early on if we get to see you early on. So I think my message is that don't struggle and think everything's hopeless and that all you have is either trying or doing IVF. There is a lot of room in between those two things for detective work and troubleshooting, and most people can solve things on their own or with very limited interventions, can't they, if we just know what's going on.
Yeah, and that's why the evaluation is so important. You know, almost 50%
Yeah.
of the evaluation is the history. So to understand the story, you know, I always tell women that, you know, menstrual cycle, it really is like a vital sign for women. It can tell us so much about what's going on. So are periods regular? Are they particularly painful? Do they just, you know, miss for months at a time? You know, things like that give us a lot of clues as to what could be going on and what are some ways to intervene.
And I think we'd be surprised by how similar our questions are, even though we practice different versions of medicine. I bet we ask a lot of the same questions. I'm just looking for patterns of disharmony as I go through. Emma, I think you probably have a question that you got beforehand on Instagram, so fire away.
So someone wanted to know, they said, should I worry about losing my eggs? Is there anything I can do to slow down the number of eggs I lose each month?
It's a great question. I know it's, I know it's something that's, you know, top of mind for a lot of women. The biologic clock is a huge thing. It's been, you know, in the media and just public consciousness for a long time. And, you know, as women and, you know, individuals are delaying childbearing due to education, advances in the work field, yes, we are going to kind of run up against this biologic clock. It's real and it's something to recognize, but, you know, it is also important to know that, you know, it's not necessarily all negative. You know, if you come in, you have an evaluation, there are things that we can do. Everyone's clock is a little bit different. What we tend to go by is age, because at a population level, that's some of the biggest predictors of, you know, your ability to get pregnant and to carry a safe pregnancy. But I still encourage women of all ages to come in and be evaluated, because there are tweaks between individuals, differences that can mean sometimes it's shifted a little sooner, sometimes it's shifted a little later, and we don't know that until we start the evaluation. There's nothing really that we can do to stop the clock or to slow it down. But, you know, in terms of fertility preservation, sometimes there are things that we can do to, one, just keep our bodies as healthy as possible until you're ready to start a family. So I always think that's really the first thing. Eliminating smoking, toxic habits like drinking, try to, you know, limit that, even caffeine, making sure that you have adequate rest. You know, stress reduction techniques are always going to be paramount for all of us in this current world. And then also simple things like a diet and exercise program that allows you to maintain a healthy weight for you. So those are the kind of things that I would say are forefront in just keeping yourself as healthy as possible. There are fertility preservation methods that, you know, we'll be talking about that can, you know, give you somewhat of a little pause on the biologic clock, but actual ovarian aging, unfortunately, we do not have a way to slow that down.
Well, I agree with Dr. Jackson-Bey that it's sort of, it is real. So we do have to take aging into account. And you can feel pretty good and then be shocked by the fact that your reproductive reality is different to how you feel. I think that happens quite a lot with our patients. And I'm often asked, you know, can you change egg quality? And I think it would be truer to say that we can help you help each egg live up to its potential. You know, if there's DNA damage to an egg, we're not going to wave a magic wand and make that, repair that. But as you get older, what happens is your eggs are variable quality, and sometimes they don't quite perform up to par. And that's where all these lifestyle things come in, because everything helps what I would think of as sort of the mitochondrial activity of the egg, the energy of the egg. So eating a very nice, clean diet is helpful. And obviously, as Dr. Jackson-Bey said, dropping your toxic habits is really helpful. And we're really happy to help you with that. You know, but we're not remotely sanctimonious or judgy. We will help you. But smoking being particularly important, limiting drinking coffee seems to be really important. Exercise gets controversial because you'll read that you can over-exercise and affect your fertility, but that really is over-exercising. But keeping your blood moving every day is an important part of resourcing your whole body, but also resourcing your ovaries. And then troubleshooting anything, the things that Dr. Jackson-Bey was talking about earlier, menstrual irregularities. It's not enough to just say, oh, you know, I can have fertility treatment, so it doesn't matter. It's a sign. It's a sign of things going a little awry. And that's why I call it the premester. I always think that 3 months before you try and get pregnant, we can, if you come and see us, we will map out a premester for you that is all about healthy eating, dropping some toxic household chemicals. There are endocrine hormone disruptors in household cleaning products and things, and you don't.
I'll send her a little message, and oh, there we go. We lost her for a moment.
That was a weird thing. And you don't need a lot of the, they're more expensive anyway, all these fancy cleaning products. Really, you just need white vinegar and baking soda and things like that.
I agree.
We can help you. It's cheaper and it's better for you. And just get a sort of regimen going that feels good to you, that feels nourishing to you, that isn't punitive or miserable, but is like, you know, I'm really looking after myself so I can be, if you're a woman, a receptiveness, so I can be, you know, a great place for a pregnancy to begin. And I think starting to see yourself as that and preparing is really wise. So 3 months, I think, is a good amount of time to sort of knuckle down and work on some habits.
Well, I love that idea of a premester. It's, you know, it's holistic, but it goes to what we teach as well in terms of preconception care and preconception health. And so I always, you know, tell women, I want you to enter into the pregnancy as healthy as possible. Because pregnancy really is a stress test. It's an endurance test. It's the marathon of every organ system in your body. And so starting in the best possible health position is always going to be a benefit.
And men, of course, a male partner, if you have one, they get forgotten, but they do contribute half the DNA to this project. And therefore, the work they do on themselves is also really important. And in many ways, the work they do on themselves is easier to see because male reproductive status changes quite quickly. They make new sperm every day that come into fruition in 72 days. So they can have a different reproductive reality in about 3 to 6 months. And so making sure that they are also having a premester is a really good thing. They may not be preparing for the actual pregnancy and the sort of physical strain of that, but they are contributing. And usually when I explain that to my male patients, they're enthusiastic about sort of making their contribution, their genetic contribution to this child as healthy as possible, I think. And we can give them a program. It can be as simple as just taking a male supported prenatal vitamin, of which there are many on the market these days, to again dropping some unhealthy habits that affect the DNA of sperm, to getting some blood moving and some circulation and managing stress. All of those things affect the quality of sperm, which is important. Now, I noticed we had a question on the
yes, I was going to say, so we have received a few questions about endometriosis, so I definitely wanted to touch on that. So someone in the chat said, I'm 42 and have endometriosis. Is it safe for me to conceive naturally?
Wow.
Yes, from our standpoint, there's no particular danger from conceiving naturally in the setting of endometriosis. It is important to know that both age and endometriosis can make it harder to conceive. And so, you know, I would recommend, you know, even if you're trying to conceive naturally, to do it in conjunction with a doctor, maybe have an evaluation, just to recognize things that you may need to be aware of. Make sure the uterus is perfect, make sure the ovaries are functioning well. And then that way you can already be looped in case you need help in the future. You can also be looped in for early pregnancy monitoring, so make sure everything is going okay before you go to your OB. And so there's no particular danger from it, but just know that there can be some challenges ahead. And so I would recommend being seen sooner rather than later.
I also think that with endometriosis, and people get pregnant with endometriosis, and it sort of depends on how advanced the endometriosis is and where it is and things like that. But one of the issues that I do see is that often the inflammation that goes along with endometriosis causes a bit of an immune reaction that can make implantation a little harder. So anything you can do that is anti-inflammatory is actually really helpful in your sort of quest to get pregnant with endometriosis, I think. At Yinova, we take people off foods that are known to be inflammatory, like dairy and alcohol, coffee. We put them on a slightly sort of lower carb diet sometimes, which seems to help. Sugar is an issue for inflammation and that kind of thing. And I think at 42, if you're trying to conceive with endometriosis, it's worth really taking extra steps to get inflammation down. Endometriosis also responds well to exercise. It has a sort of estrogen dominance at the in the background, and it just responds well to some movement. So moving becomes really good. And I really agree with Dr. Jackson-Bey that at 42, it's entirely possible that you can get pregnant with endometriosis, but it would be great for you to have a doctor on your side at that point, so that you can make smart decisions, because you have a something of a time issue and you don't want to waste time. So you wouldn't want to just be trying blindly for months and months on end. So if you came to see me as a patient, I would pack you off to see someone like Dr. Jackson-Bey, because I'd want you to have all of that testing very early on, so we know exactly what we're dealing with.
Absolutely, I agree.
One question that I hear a lot of people ask, and that I have asked in the past too, and we've been talking about assessments and getting testing. What is a fertility test looking at?
So I always say that the fertility evaluation for me looks at about 4 different parts. One is, the ovary. How well is the ovary functioning? What's the communication like between the brain and the ovary? How efficient is the ovary in producing eggs? Do you ovulate? All of that has to do with ovarian function. 2, I want to look at the fallopian tubes to make sure that the fallopian tubes are open, that they're free of obstruction. If the fallopian tubes are essentially like a 2-lane highway, the sperm and the egg have to meet there, and then the embryo also has to travel within the fallopian tube to reach the uterus to implant. So want to make sure that that is not a roadblock per se. We also look at the uterus on ultrasound, and sometimes we even use some other imaging modalities, saline-infused ultrasounds or hysterosalpingograms, which can let us know if there's any issues that need to be addressed at the level of the uterus. Is there, uterine fibroids that could be in the way, extra tissue, a polyp, scarring from prior procedures or surgeries. And so that's a very important step as well. And then lastly, the sperm source, whether it's from a partner or a donor, we need to make sure that the sperm are present, that they are a good number, that they move well, and that they look, normal in terms of the shape. So that's essentially the 4 parts of like the very basic infertility evaluation.
Thank you. I feel like it's helpful to get a foundation understanding of what that assessment will be looking at. Someone had asked, what is a good fertility herb for me to take, or is there one specific fertility herb that I should be taking?
Well, there isn't one specific fertility herb. You can imagine that this crops up quite a lot. People arrive in our office and they have a herb that they read about on the internet, and they take it because they've heard it's a fertility herb. But as Dr. Jackson-Bey will tell you, there's 1,000,001 different reasons why people don't get pregnant, and she has lots of different things in her armory for that reason, and we're the same. So there isn't a one size fits all. And I think often, there's a lot of marketing that goes on, to be honest. And so a lot of people market things as a fertility enhancement herb. To be honest, that's not particularly helpful. What is helpful when it comes to herbology is to do a good diagnosis and intake, and then prescribe herbs to treat you. And that's why at Yinova, and we've always done this, we make a separate herbal formula for every patient. It's obviously very labor intensive, but it also is very effective. And so we have a pharmacy in each of our offices. We have 3 offices, and we make up a separate herbal formula. And we never give a single herb, or almost never. And the reason for that is because you are not, you're not that straightforward. Human beings aren't that straightforward. We're treating a whole person, whole people get pregnant. So we tend to prescribe a constitutional formula for your constitution. And then we prescribe different herbs as you go through your cycle to regulate bits of your cycle. And an experienced and board certified herbalist can make your cycle sing. I watch people's BBT charts. I can change when they ovulate. I can tighten up a slow transition at ovulation. We can keep people's progesterone up. There's an enormous amount we can do. And what I tend to do with my patients, and I know this is true of my colleagues at Yinova, is we set goals. One of the things that has always bugged me about certain aspects of alternative medicine is the open-ended nature of it. And I was actually trained by doctors who, I did my residency in a hospital, and it did me so much good because they kicked my butt. And I learned to be, to measure efficacy and to plan treatments based on, real evidence of efficacy. So we set goals at Yinova, and then we set about solving things. So for instance, if someone comes to us because they want to get pregnant, that's clearly their long-term goal. But short-term, we will set goals like, ovulating day 14 if they're not doing that, no mid-cycle spotting, no PMS, no painful periods, no clotted periods. We're busy solving things that are measurable and that we and the patients can see, and we hold ourselves to that. And to do that, we have to prescribe different herbs at different times. We troubleshoot as we go. So I think herbology done right is a very dynamic process, and that you're best doing it in conjunction with a herbalist who is tracking you through your cycle and making changes as you change, because you progress, you get better. I had a patient this morning, I've been seeing patients all morning, and she had a very short luteal phase, which is a problem. Because it means that no sooner has an embryo started to implant and wave, hello, I'm here, her endometrium is sloughing off. And so we have been lengthening her luteal phase, and it went from 10 days to 12, and today it was at 14 days, which is where it should be. And so that is now off my checklist, unless she slides back, and I have changed her herbs accordingly, because she's, mission accomplished there. And that's good herbology. So that was rather a long answer to a question, Emma, but there is no one size fits all.
That was interesting. And that's great to hear about your patient too. That's exciting.
I know. I celebrate these little triumphs on the road to pregnancy.
So we have 2 questions that were sent through the chat. So I'm just going to go through the first one, which is a 2-parter. So it says, hi, I'm 31 years old and I did IVF, but only retrieved 7 eggs. Is that normal for my age? And do you recommend doing genetic testing on eggs?
So normal is, a little bit of a misnomer, because every single person is different. And so just based on your age, we can't tell, how many eggs to expect from IVF and from one cycle. So I would, shy away from maybe comparing yourself to other people, kind of focus on, what your specific issues are. Sometimes younger women can have lesser ovarian response. Sometimes older women can have more. And so it can be very varied. In terms of genetic testing on eggs, unfortunately, at this time, we can't test eggs for their genetic makeup. The one way that we have would be to create embryos from those eggs, let the embryos grow for about 5 days. And then the embryo is sophisticated enough that we can take some cells without much damage to the embryo. And so at that point, we can test and see if there's a normal number of chromosomes. But unfortunately, at the level of the egg, we're not able to do that, not yet at least.
There's more and more of this pre-genetic diagnosing of embryos going on, though, isn't there? Yeah, that it's become quite common. I often think in patients, particularly patients who've had repeated miscarriages, it makes a lot of sense to protect them from further miscarriages by pre-genetically diagnosing embryos. It seems a really good use of the technology somehow than go through the trauma of miscarriage over and over again.
Yes.
So someone else was wondering, they said, I'm 35 years old and I have PCOS, and they wondered what your insight was from an Eastern and Western perspective on PCOS and fertility.
Well, I will give you my Eastern one, and then Dr. Jackson-Bey will give you the Western one. PCOS, and I think actually Tira will agree with me here. It's a bit of a misnomer at this point, because it's not really about the polycystic ovaries. And I think if we were naming it now, we'd probably give it a broader name, because it's a bit of a syndrome. And it seems, and we didn't used to see it this way either, it seems to be a bit of a continuum. You can have a mild case of PCOS, you can have a more severe case. And really what it is it's a whole body syndrome that is about insulin resistance and metabolic issues related to that, leading to elevated androgens, which and then cysts on the ovaries and irregular menses and that kind of thing. We treat a ton of it in conjunction with, fertility practices like RMA. Acupuncture is particularly good at getting the cycle to be regular in PCOS. And there is actually interesting clinical research out there. And here's what's interesting about the clinical research. They started by doing research on rabbits. And I didn't know this till I read this research, but non-sexually active rabbits do not ovulate. Who knew? And not me. But they found that they could do a certain acupuncture protocol and get the bunnies to ovulate. And then they did the same protocol on anovulatory women with PCOS, and it worked. It's the same. Works the same as on the bunnies, it turns out. So we're usually quite good at getting people to ovulate regularly. And one of the things that I see over and over again in PCOS is diet is huge for PCOS. And you're unfortunately, if you have PCOS, very sensitive to sugar. And you start to put on what I call unfair weight. We all know what fair weight is when you've just sat down and eat a load of ice cream. It's sort of fair weight. But people with PCOS put on unfair weight. It's just like, it's so easy for them to put on weight. And the way out, and I've seen people really regulate their cycles like this, is to cut carbs quite considerably. And it's not that I really want to cut carbs out of your life, but in people with PCOS, it does really work to regulate the cycle to go very low when it comes to carbohydrates. I just had a patient this morning that I put on the Whole30 as a start to tackling PCOS.
Yeah, that's a great way. Diet is definitely going to be huge in management of PCOS. And I know sometimes that can feel a little antagonistic. Patients don't want to, change their diet. But I think if you were able to commit to it 3 months and saw the changes, you probably never want to go back. It doesn't have to be extreme. It doesn't have to be, strict ketogenic. But I agree, something like the Whole30, reducing simple carbohydrates, maybe even reducing dairy for some women, increasing protein and healthy fresh fruits and vegetables, and you will see a difference. PCOS is a metabolic syndrome, and so it has far-reaching consequences. I think it gets a lot of you just attribute so much to reproduction, and that's maybe where most women hear about it. Younger women may hear about it more so about their irregular periods, and so they kind of focus on that. But it does, predispose you to diabetes, to cardiovascular disease later in life, and even to endometrial cancer in some women. So it's something to really pay attention to and manage. The reproductive aspect is part of it. And so if you're not looking to get pregnant at this time, or even if you are, working with your provider, working with a group like Yinova to make sure that you're in the best shape as possible is always going to be important.
Actually, your mention of endometrial cancer makes me want to add in that often women with PCOS, if they're not trying to get pregnant, let these very long cycles run on. And it's not necessarily a good idea, you know, that your endometrium is just building up and building up and building up and you're not ovulating, and that increases your risk of endometrial cancer. And so it is actually important, even if you're not trying to get pregnant, if you have PCOS, to find a way of regulating your cycle, whether you do it through Eastern or Western medicine. But I would get a doctor and get some advice about getting your cycle to be somewhat regular. It doesn't have to be perfect, because I often meet people who go 60, 70 days without a period, and there are consequences to that long term.
Absolutely.
We'd rather do that.
Thank you. That was interesting. I didn't know that. So we have a few questions about supplements. So maybe switching gears slightly to that. So someone said, how advantageous is CoQ10 for fertility in a woman in her 40s? Is a prenatal vitamin coupled with a CoQ10 supplement safe and advised?
Yeah, so coenzyme Q10 is an antioxidant. It's readily available over the counter. And so what an antioxidant does, all of the cells in our body are undergoing what we call oxidative stress all the time. It's just a normal kind of assault, both from oxygen within our bodies and in the environment. And as you age, your cells' ability to kind of repair themselves and fend off against this oxidative stress is somewhat compromised. And so the thought is that using antioxidants like coenzyme Q10 can kind of boost your cell's immunity to repair itself and perpetuate that. And so, you know, there is some thought that using the antioxidant like this for women who are older, for women who have a harder time getting pregnant due to ovarian dysfunction, lower ovarian reserve, things like that, that it could be helpful. It's not a silver bullet. It is something to kind of do in conjunction with your treatment, with, you know, providers, but it's not harmful. And so, you know, if I see a woman who maybe is, you know, have diminished ovarian reserve, they really want to feel motivated to do something, this is something that you can add to your regimen that may be helpful. Prenatal vitamin goes without saying, because that's really important. The most important part of that is the folic acid or folate. That needs to be in your body during that prepartum period, because, you know, really folic acid is most important in organ formation and then the neural tube formation, which is brain and spinal cord. And so those things are forming before you even have a positive pregnancy test. So if you start your folate supplementation late, then you've kind of missed the boat. So it's fine to take both of those things together. It's definitely want to make sure that you have the prenatal vitamin on board, and to add the CoQ10 in some situations can be beneficial.
It's one of those supplements, you know, I said that we can help each egg live up to its potential. Well, as you get older, I think CoQ10 is one of those supplements that helps the sort of mitochondrial activity of the egg. So it's something that I'm very in favor of. I also think some kind of fish oil or essential fatty acid is a good idea, along with our Yinova prenatal has an essential fatty acid in it. And that's because there is research that when everybody got very scared of eating fish in pregnancy, that it was affecting cognitive ability in babies. So an essential fatty acid is the way to go, a good quality one that is the way to go. But this makes me think of another question, Dr. Jackson-Bey. CoQ10 is sort of harmless and may do good. So this is a good thing. But I often get asked about DHEA, and I don't see that as in quite the same category at all as sort of harmless but may do good. We don't stock it at Yinova for that reason, not because I'm completely against it, but because I think it should be prescribed by a doctor who's measuring DHEA levels. And I wonder what you thought about DHEA, because a lot of people just buy it over the counter and take it.
I agree. I'm not the hugest fan, so I wouldn't put it in the do no harm and maybe good category. DHEA is a testosterone, a form of a male hormone. Androgen is what we call it. And so there is some thought that, androgens are precursors and from there, you can develop other hormones that may be needed in your reproductive cycle. And so that was, some of the thought behind supplementing with DHEA, particularly in women who are maybe older or have diminished ovarian reserve. What I've found anecdotally is, one, sometimes patients get ill effects from it, like acne or hirsutism. Sometimes it can be pretty mild, but the fact that you may have some side effects without much benefit is what makes me shy away from using it. There are some cases where maybe it could be helpful, but I tend not to recommend it too much.
I'm the same. And, we mentioned PCOS. Often people with PCOS have high DHEA, actually. So the first thing you need is to have a baseline test. You shouldn't just be taking DHEA without having a test. And I think the people we do see people get side effects from it. And I think that those are probably those people that already were starting with quite a high level, and then they start to have the effects of male hormones, and they get acne and unwanted hair growth and that kind of thing. I also see people get a few sort of menopausal kind of symptoms from it. So that is the one that I would be very much guided by a doctor. But CoQ10, you can go for. It won't do you any harm, and there is evidence, I think, that in some particularly older women, it does some good.
Thank you. That's definitely useful to know. So someone else said, I am slightly anemic, so always trying to get more iron. Other than iron-rich vegetables and greens, is there a best way to supplement iron so that it's absorbed but doesn't constipate you?
Yes, I have a solution. Floradix. Floradix is like magic stuff. I don't know whether you're familiar with Floradix, but it is a liquid iron supplement with herbs from Germany. You keep it in the fridge. It's perishable. And it tends not to constipate people. It's very safe. The pediatricians use it. The OBs use it. We have it on stock at Yinova the whole time. I think it's important to get your anemia sorted out. And you could start with Floradix, but then get your levels measured, because it's relatively mild and you may need more than that. But I believe that Floradix, I have no interest in this company at all. I genuinely, over many years, have seen it raise people's iron levels without upsetting their stomachs. It's a good thing. What do you think, Dr. Jackson-Bey?
That's great. Sometimes taking iron along with something rich in vitamin C can improve absorption as well. And so whether that's a vitamin C supplement or, a glass of orange juice, you have to watch the sugar. But that has been shown to help as well. Iron is hard because it can be constipating, but just make sure that you're looking at your diet overall. Are you getting enough water? Are you having enough fiber? Things like that.
I can also vouch for Floradix. I've been taking it since I was a kid, and it tastes really good. It's not really the point, but
it does taste nice. Yes.
So we have a few more questions. I want to be careful of everyone's time too. So if you have any more questions, feel free to submit them now. Someone said, would you recommend acupuncture prior to IVF? And at what point would be the most beneficial, and for how long?
Oh, this is a good question, and I'm happy to answer it. So I would recommend acupuncture along with IVF. There was a very well-known study now called the Paulus study, where they looked at 180 women going through IVF, and half did acupuncture with their IVF and half didn't. And the half that did acupuncture had a 50% better outcome. There's no doubt that acupuncture helps the outcome of IVF. And for a long time, that made researchers focus on giving acupuncture before and after the transfer of an embryo. So I was actually really interested when a colleague of mine, Dr. Lee Hollander, who I have known for many years, did some research. She did a meta-analysis of a considerable number of women, over 1,000, who were undergoing IVF and did acupuncture. And here's what she found. She found that the people who did 3 months, what we were just talking about as a pre-mester, of what she called whole systems Chinese medicine, which means everything we do, herbs, dietary advice, lifestyle advice. It's the very thing that Dr. Jackson-Bey and I have been talking about. People who did 3 months of that had higher live birth rates than people who just did acupuncture around the transfer. And but the people who did acupuncture around the transfer had higher live birth rates or higher pregnancy rates than the people who didn't do acupuncture at all. So that confirms something that I sort of instinctively felt, which is exactly what Tia and I were just saying. Healthy people go on to have healthy babies for the most part. So there is no shortcut. So if you can afford it, if it is part of your budget, it is worth doing acupuncture for the 3 months before you get pregnant. And there is research that or the 3 months before you do IVF. And there is research that shows that that's helpful. Now, if you can't, or you're just about to do IVF and discovering acupuncture, it's still helpful to come and see us. And we will obviously work with you in any way that works for you. Our aim is to help you. And we know these things get expensive. We do actually have a new membership scheme that I think is cutting prices for some people who have to come and see us regularly, which I think will be fun. But if you can come in and see us for the 3 months before, there is a big meta-analysis of well over 1,000 people that shows that that is the optimal prep for IVF.
Jill, can you speak to, acupuncture versus kind of acupressure or magnets, or what would be some of the differences there?
Yes, thank you for asking that. There is a difference. Acupuncture is a little electrical intervention. And, for a long time, when I was working in a hospital, I would do something that had a measurable result. And the doctors would say to me, how did that work? I'll give you an example. I used to work in an OB department, in a labor and delivery department. And there was a point I did that it used to cause the cervix to dilate. And it was actually quite magical. We eventually got an NIH grant to study it because it was so interesting. And the doctors would say to me, how does that work? And I would say, I'm not completely sure, which is very unsatisfying, particularly to say to a doctor, because they give you the look in the hospital. But I know more now than I did then. When I was writing my book, Energy Medicine, one of the things that I was interested in is that acupuncture points are specialized tissue. You can see them on MRIs. You can see that they're different. And there's interesting research at the University of Vermont Medical School where they showed that the acupuncture points, if you put a needle in them, the grab force, what they call the pull force of the body, is 20% higher at the acupuncture points than other parts of the body. So as I was writing this chapter in my book, I thought, well, I wonder why that is. I wonder why we have this weird tissue. And it turns out that the answer lies in embryology. And I don't know whether you've ever thought about how an embryo makes itself, but it doesn't have well-developed communication systems like the cardiovascular system or the central nervous system, which is how messages get mediated normally through the blood or through the nerves. And so what it does is it creates itself, the embryo, electrically. And there's a lovely video on YouTube from Tufts that shows a frog embryo. It's called electric frog face, creating itself. And there's just like lightning going across its face. So what an embryo does is it creates little nodes, which are very electroconductive tissue that change polarity. And when they do, it buds off the next part of the fetus. And if you overlay a map of those embryological nodes on the major acupuncture points, they're in the same place. So I think the acupuncture points were at one point very electroconductive because they were there to create us, and now they're less potent, but we can use them to regulate us. And I think the needle is important for that. Now, there is acupressure, and it does work, but it doesn't have the same kind of electrical intervention. Same with laser acupuncture, that it's helpful to stimulate these points in different ways, but I may be old-fashioned because I've been an acupuncturist for a long time, but I think nothing quite replaces the needles when it comes to that. But I'm really glad you asked that question, because I can answer it better than I used to be able to.
That's great. Thank you.
I love hearing you talk about the electric frog face and that connection between embryology and and what was used to create us is now used to regulate us. I think that's really cool.
Well, you know what's interesting is that if you overlay a map of the major fascial planes over the meridians, they're also in the same place. So fascia is tissue that goes everywhere and, you know, wraps muscles and wraps organs, and it's highly electroconductive. It's what's called piezoelectric. It actually produces some of its own charge. And so we think that the way the message from the acupuncture points travels through the body is through the fascia. So we're much closer than we used to be at explaining the sort of physiology of how acupuncture actually has an effect on the body.
The science and mystery.
That was the name of my book. That was an in-joke, but my book is called Energy Medicine, The Science and Mystery of Healing.
Wow.
So someone else asked, is there anything I can do to increase follicles or eggs during IVF?
There are some different protocols that we can use, you know, without knowing anything about the medical background, but there are some different things that we can use to try to increase the number of eggs per IVF cycle. You know, everyone is going to have kind of their potential limit. And so that's different from person to person. We do think about it as, you know, more so correlated with age, but as we've been talking, there are lots of different individual factors that go into it. I like Jill's stance that, you know, regardless of the number, let's make sure that each one lives up to its potential. And so making sure that, you know, healthy from all other from all other access points is going to be the best way to go. Sometimes you just may not get a lot of eggs per cycle. Sometimes you need a few cycles to get the eggs, and that's perfectly fine. I think sometimes people can get very wrapped up in the number. What the goal is the baby. So if you have one egg and it fertilizes and it gets you pregnant, then that's really what you want to focus on.
And I've seen that so many times, incidentally. I've seen people be disappointed in their IVFs and then have, you know, a perfect embryo, perfect baby in the end. So.
Thank you. That's definitely helpful. Well, thank you everyone for joining us today and for your really interesting questions. I really enjoyed this conversation. I've heard Jill speak with reproductive endocrinologists before, and I feel like I always learn something new, and this was definitely one of those cases. So thank you so much, both of you, for sharing your time and your wisdom with us today. And RMA will follow up with a link to this recording. And if you have any questions, you can reach out to them and to us.
Awesome.
And I just wanted to say, apart from thank you, Tia, this was lovely. And we should do this again. We should tackle various topics.
Absolutely. Yeah.
I really love doing this with you. I wanted to say that we do have a coaching curriculum at Yinova that's a little cheaper than the coming in for acupuncture. We have a coaching group. I think we have a new one about to start. And people love that group. It's a combination of support and coaching. It takes you through your own, it's only 8 weeks. It's not forever. And they meet once a week and they take you through a whole, how to get a pre-med stuff, basically, how to get yourself in shape. And I think Emma is putting that in the chat, but I think there's a new one starting. So if any of you be interested in that, it's led by senior Yinova practitioners, and they do a lovely job of coaching people. And I think our last group loved it so much that they now meet without us. Isn't that true, Emma? That they got so bonded together that they just meet on Zoom for happy hour. Yeah, it's nice to go through support with other people, but with an aim, I think. So I just wanted to give a shout out to that.
Absolutely. That's awesome.
Well, thank you, everyone. This has been really great. We'll see you guys next time.
All right. Have a good one.
Bye, guys.
Bye-bye.